So you can see a timeline of the history of regenerative medicine. Dr. Baumgartner's a partner in it. I had already been playing rugby. I already had all those knee surgeries before 2009. And I was playing on the weekends. I would limp all week long. And then one of my patients that I was training, well, at Gold's Gym, finishing grad school, did prolotherapy with Dr. Baumgartner. He's like, you should go see him because I had already tried surgery. I did E-stim. I was on the cortisone. And 3 months later, I was playing again without a limp. And him and I got to talking, and we talked about the show, The Biggest Loser, and how if we got patients better and moving and eating and exercising, then he could regenerate their joints better than if they weren't willing to eat better and exercise and move. So we joined forces in 2009, and I went from a little 80 square foot room and thought all of his patients would come over, but some just wanted a cortisone in a pill. And I started marketing medically supervised fitness and weight loss, and those people coming in wanted to get better, and they made for better regenerative patients. So we started growing really fast. But then I had another knee surgery, my sixth one, and this is where it gets interesting. And on my sixth one, the orthopedic, and I had tried PRP and it didn't fix it. I was bone on bone arthritis at that standpoint on my knee joint. And I had tried PRP and I was still in a lot of pain. And Dr. Baumgartner in late 2010 began doing stem cell regenerative medicine, bone marrow aspiration, and then you re-inject into the knee. And when I had that sixth surgery with an outside surgeon, they're like, JR, you're going to have a partial knee replacement and give up the contact sports. And sports were my identity at that point, Zane. I had some difficult childhood upbringings with, abandonment, bullying, addictions of different kind, had a lot of challenges. And so I was just like, what am I supposed to do? Sports are my outlet. There was nothing that I wouldn't pay, even though I didn't have much income at that time, to again continue to play sports. And I said, is there anything I can do? And she says, well, you can give up that type of sport like rugby. You can do an oat surgery. But how bad this looks, I don't know how well it's going to do. And, I was just like, well, I need to think about this. And I went back to Baumgartner because I was now working with him. And I'm like, I don't know. And he's just like, I'm literally finishing my certification and training in this procedure. Why don't you just be our first test patient? So I had that bone marrow aspiration. 6 months, they put me in a loader brace that took the pressure off this medial side like this. So it was more like this. So the medial side could begin to heal. And 6 weeks later, I could go down the stairs for the first time without shooting pain going up my body. At 6 months later, I was jogging straight on a treadmill with no pain. At 12 months later, I was back on the softball field and I was playing, and it didn't even kind of hit me because that story was like, I'm not going to have this. And even though I was seeing progress, it was like almost hard to wrap my head around how believable this was. And so I'm out there and I just start crying, realizing, wow, I didn't know that I was going to be able to do this again, and avoided a surgery. And then literally 16 months later, I'm back on the rugby field. And unfortunately, I got another injury that didn't extend my rugby days too long with the frozen shoulder that kept me out a long time. I've had more than my fair share of rugby injuries. And I instantly became such a believer, Zane, is like, there's so many people that have drugs as their only option, cortisone or surgery. Even my mom had a bad surgery that she's never fully recovered from an orthopedic one. And it's one of those things like, I'm hopeful someday that insurance covers these things for people that think there's no hope and solutions, but I fully believe the body can heal and regenerate when you give it the right tools, the right practitioners, the right medicine. And my prayer is, that it comes. But since this date, I've been involved with building regenerative medicine clinics around the world, adding the different components that enhance those outcomes. We've been in numerous studies and research groups of what gets the best regenerative medicine outcomes. That's the passion, is to help other doctors that do believe in this alternative, or people learn like, you got nothing to lose. You can't go back from bad surgery. Worst case scenario, you may be out the investment, a few $1,000s, but 90% of the time, people see amazing progress on these things. I see people fully recover, unbelievable stuff.